Namaste and hello everybody. Welcome back to our discussion on the trio of restlessness by Dr. E.B. Nash. So he mentions three remedies under this trio, which is aconite, arsenicum, and rustox, and that is why it's called a trio. There are a group of remedies that Dr. Nash, mentions together because of a characteristic indication which is present in all three of them. And we've already discussed how restlessness is present in aconite, along with what characteristic indications it is present and how it is different from arsenic and rustox. Today we're going to talk mainly about the remedy arsenic album as Dr. Nash gives it in his own Materia Medica. Alright, so let's start with the remedy arsenic album and how it comes under and why it comes under the trio of restlessness by Dr. Nash. So starting with the topics that are present in this remedy as to so that you know what to expect from this video. So Dr. Nash talks about this remedy, first of all starting with the restlessness of this remedy, then going on to the burning of this remedy, because burning is a characteristic sensation that is present in this remedy. Then he talks about the GIT symptoms of this remedy, followed by respiratory organs and prostration, which is again a very important characteristic of this remedy. Okay, burning and prostration are very important characteristics. Restlessness obviously is there. GIT and respiratory organs are important spheres of action of this remedy. So that is how Dr. Nash again briefly explains the remedy, but very beautifully and aptly presenting the remedy to us. Okay, so let's start with restlessness of this remedy and how it is different than the restlessness of aconite. So Dr. Nash gives us a differentiation table between aconite and arsenicum, where he says that aconite, first of all, is seen in the earlier stages of inflammation with fever of a high grade. So that this thing we have discussed in our video on aconite by Dr. E.B. Nash. Okay, so aconite is actually used in the first stage of inflammation, earlier stages of inflammation, and there is high grade of fever along with it. But when we talk about arsenicum, arsenicum is seen in the later stages after the patient has become greatly reduced in strength, that is prostration, exhaustion, fatigue. Okay, so after the patient has become greatly reduced in strength in the later stages, this remedy is indicated, and there is low grade fever in arsenic like typhoid. So like typhoid is a low grade fever, so these type of fevers are present in arsenic, whereas in aconite there is a high grade fever and it is in earlier stages of inflammation, whereas arsenic is in the later stages of inflammation. Then, in aconite, the patient will toss about to and fro in agony and fear. As we have already discussed, agony is a very important word for aconite. So, in agony and fear, these patients will toss about. Whereas in arsenicum, the patient is too weak to even toss. Okay, see, we saw that there's great reduction in strength, there's great prostration, there is great exhaustion, fatigue. So, this patient is too weak, he is weak, so weak that he cannot even toss about, as the anguish and restlessness would incline him too. So the anguish of the patient, actually that the patient feels, the restlessness that the patient has inside him, cannot actually get expressed, or he cannot actually be move around, because he is just too weak to do that. He cannot move himself around as he desires, but he wants to be moved from place to place or bed to bed. Okay, while the least exertion on his own part exhausts him terribly. He wants to move, he cannot move. He wants to be moved, okay, from place to place, but even least exertion will exhaust him terribly. Now in aconite we see that fear of death is present, especially. Okay, there are many kind of fears, like fear of society. We have seen this in the earlier video. Fear of society is there, fear of crowd, fear of that something will happen, something bad will happen. Okay, fear of crossing street, but the fear of death is the most prominent thing. Okay, the fear of death. And in arsenic, anxiety and feeling that it is useless to take medicine, for he is going to die, he is incurable. So this patient is hopeless, he feels that he is going to die. So there is no use of taking medicine, there is no benefit of taking medicine, because he is going to die and he has an incurable disease. There is nothing that they can do, he's going to die. And because of that, when death is near, what you feel is you feel fear. So that is what they feel. They feel anxiety because they have a feeling that they won't be getting better, they are going to die. So fear of the disease being incurable is mainly more prominent. Okay, and here fear of death. All right, so that's the thing. In aconite we saw earlier stages of inflammation, later stages of inflammation. Here high grade fever, here low grade fever. Here tosses about in agony and fear. Here too weak to toss. Here fear of death, and here fear of the disease being incurable. Right. So that's how he differentiates them. And then we talk about the restlessness of arsenic, which is both mental and physical. Not only mental, not only physical, but both. In rustox, the restlessness is mainly physical, whereas in aconite the restlessness is mainly mental. but in arsenic it is both mental and physical equally. Okay, now this anxiety will drive him out of his bed. He is suppose lying in his bed, but now there's so much anxiety that he wants to get out of his bed. He wants to continually change place even if he has no pain. Okay, he has this inherent restlessness even if there is no pain. Okay, it's not like because the patient has pain and he wants relief, he's going and moving because moving will feel may make him feel better. Even if he has no pain, he has this restlessness inside him that which makes him want to continually change place, which makes him want to move out of the bed. Okay, he wants to walk about if he is strong enough to do that, but he isn't because there is a great frustration. Okay, so he wants to walk about if he is strong enough, but he isn't. He is very very well exhausted. So just because he can't keep still, that is why he wants to move. Okay, there's no pain or nothing that makes him move, but just because he can't keep still, he wants to move. Now here, Dr. Nash presents a case to us in which he say not presents actually, he tells us that if there is a case and if you prescribe arsenic in that case, then what is the beneficial effect that has to be observed. So suppose you yourself have a patient and there are all characteristic symptoms of arsenic present and you give him arsenic. Now you will feel that I have given arsenic. How will I know that the remedy is correct? Okay, that the patient is improving on arsenic. How will you know? What are the signs? So now here Dr. Nash tells us how you can judge whether your patient is feeling better or not, whether the remedy is acting or not, whether the remedy is correct or not. Okay, so the anxiety grows less. That is the first beneficial effect to be observed. The anxiety which your patient will have, it will grow less, it will reduce. The patient lies still. See, you know that this patient wants to drive out of the bed, he wants to continually change place, he wants to, he is very restless, he wants to move continually. But now this patient lies still, he wants to lie still. His pain is not so much less. Okay, maybe his pain is not so much less, his complaints are not so much less, but the anxiety is less and the patient lies still. But it does not make him so restless. The pain does not make him so restless that he can bear it better. Okay, now he can bear it. Okay, he does not want to really go and move, he can bear it. This is a good sign, generally is followed by amelioration of all the symptoms. Okay, this is a good sign, and after that will follow the amelioration of all the symptoms. The patient will feel much better, but it starts with this. Now, Dr. Nash says it makes little difference what the disease is. If this persistent restlessness and especially if great weakness is also present, don't forget arsenic. So, this combo should be there, okay? Restlessness plus weakness. Even when we were talking about the differentiation between the remedies, aconite, arsenic, and rust ox, when we were talking about the restlessness, how the restlessness differs in all three, in the aconite video by Dr. Nash, we talked about this, and in arsenic, over there also he mentioned the same point that there is restlessness plus there is extreme frustration plus there is reduced vitality. Now here also he says that if there's persistent restlessness along with great weakness, frustration, do not forget arsenic. So this combo is equals to arsenic. Okay, make it very clear to you make it very clear in your mind. Okay. All right, and then we also saw in aconite there was fear plus pain plus restlessness. That was a combo in aconite: fear, pain, restlessness. Here what is there? Restlessness and weakness, prostration. All right, so that is how we saw the restlessness of arsenic. Now let's go to the next point. The next characteristic symptom which is present in arsenic along with this restlessness, weakness, etc. is burning. Okay, burning. So about burning, Dr. Nash says that arsenic leads all remedies for burning. It leads all remedies for burning sensation, especially in acute diseases. So what he says, especially in acute diseases. So if your patient is coming to you with acute disease and has this burning sensation, then the first remedy that you should think of is arsenic, because arsenic leads all. Okay, but when you think even there is chronic complaint, okay, the patient has chronic disease and he has burning, then you can think of the remedy sulfur, because both of these have burning. Now if we over here also talk about the trio of burning that Dr. Nash actually mentions, then the trio of burning obviously involves arsenic, as we know because we're talking about it. It also involves sulfur, and the third remedy that involves is phosphorus. Remember this also. Okay, arsenic involved in acute, especially diseases. Sulfur has burning, especially in chronic, and there is also phosphorus. So trio of burning according to Nash is arsenic, sulfur, and phosphorus. And now we're discussing trio of restlessness, which is aconite, arsenic, and rust ox. Right? And we also discussed about the trio of pain when we were talking about aconite, which was, I hope you remember, which was chamomilla, coffea, aconite, right? Yeah. So that's it. Then this burning, strange as it may seem. So why is Dr. Nash saying that strange as it may seem? Because this burning simulated by heat. So there is this burning in this patient. So this whole burning does not represent like this is a patient of burn injury, but it represents the sensation that this patient feels. This patient feels burning all over his body, in every part of the body, or especially the affected part of the body. Okay, so this patient is burning sensation in the affected part of the body, which is simulated by heat. So this red color, flask is actually denoting the heat. Okay, so there is hot water inside it, which is giving amelioration to this patient. So isn't it strange? Because this patient is already having a burning sensation, which should actually normally logically be felt better only after cold application, but this patient feels better by heat, and this is a very 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 important symptom of this remedy. Okay, never forget, burning ameliorated by heat. The remedy is arsenic. Okay, burning ameliorated by heat. So heat can be hot application that you are giving, or it can be heat of warm stove that the patient goes, and whenever he sits beside a burning furnace, or he's near a warm stove or a warm room, whatever. Okay, ameliorated by heat, burning. This is a very 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 characteristic symptom of arsenic, and I hope you remember this image, and this image helps you remember this symptom. Okay, then comparison. Dr. Nash likes to compare, and it does help us in remembering better, in clearly understanding the materia medica. So, what is the comparison he does over here? He says that the exact opposite of this is Secal core. Okay, is the remedy Secal core. So this remedy may what happens is that the affected part is objectively cold. Objectively cold means you are always the subject and something else around you is the object. So when I touch this paper is an object for me, right? So this pen is an object for me, and I myself am the subject. So it is objectively cold, meaning for the doctor the patient's hand is an object, and that is cold to touch. So that is cold. When you touch it, it is cold, but subjectively it burns. So the patient himself will say that I am feeling a sensation of burning over there, but if you as a doctor go and touch that part, it is cold to touch, but the patient feels a sensation of burning. That is what objectively cold and subjectively burning means. But hot application are intolerable. Like in arsenic, we saw that burning was emulated by heat. But over here, they say in cecal cord that the hot applications are intolerable. The patient cannot tolerate. They cannot even bear to have it covered. So that is the aggravation from heat. Not only are the hot applications intolerable, but even covering will aggravate them. You will touch the patient, you will feel that, oh my god, it is so cold, you should take some hot application. That is what you will advise, but the patient won't take it, because they will also even tell you that it is extremely burning even if it is cold to touch, and they do not want any hot application, nor they want it covered. Now in arsenicum, there is burning everywhere, and that is why I have made this kind of thing. We have made this kind of thing where burning is present everywhere. Burning throat, excoriating nasal discharge, everything. In fact, everything is burning. And see, this burning is throat and present. Okay, throat mein there is burning, but it is ameliorated by eating, drinking hot things. So see, again the same thing, burning ameliorated by heat. So even if there is burning in the throat, it is ameliorated by getting the drinking or eating hot things. Excoriating nasal discharge, and again everything is ameliorated by hot application in arsenic. Then Dr. Nash further goes ahead to talk about a case. Okay, so in this case, he tells us that this patient that he had an eczema on hands. Okay, this eczema on hands got suppressed, and the patient now presented to him with severe gastralgia. So the patient, when he came to his clinic, the patient did not tell us about all this. The patient came with severe gastralgia. Okay, she presented with severe gastralgia. Now, in the symptoms that she had because of this gastralgia, along with this gastralgia, was that the pain of gastralgia would be at midnight. Okay, midnight means 12 a.m. So it would be at midnight and lasting until 3 a.m. Especially at midnight. So see, it is very characteristic. The pain is coming only at midnight, lasting until 3 a.m. During the pain, the patient had to walk the floor in agony. So there was great agony, and the patient was had to walk the floor. So keep walking, because that only felt, the patient would like had that inherent, had that thing inside them. They wanted to just move, okay, that might not relieve their pain, but they want to move. There's great burning. So see, burning is also there. There's restlessness, they want to walk, okay. And midnight aggravation, which we will talk about, is also a symptom of arsenic. So midnight aggravation is there. They want to walk, keep on walking because of the restlessness, and there's great burning. So three characteristic symptoms you found. So prescription was arsenic. Now in the follow-up, the patient said that I am feeling very, very better, very much better. So she is better, but she only had slight attack. So she was completely better, only a slight attack came and it's gone. So she's actually much better. But now she asked if she could get anything for eczema, which had returned. So now she tells us that before this severe gastralgia, she had eczema on hands, which she applied maybe some ointment, something, and it got suppressed. And now she had severe gastralgia. That is what we understand. She will only tell you that she had eczema. And now what happened is, as you gave her symptoms, gave her a remedy for severe gastralgia, looking at the symptoms which are very characteristically pointing towards arsenic. Since arsenic is a remedy which is curing the case, after curing or treating the gastralgia that this patient had, the suppressed eczema now came back. This is a very, very good sign, okay. There is a law of cure which has been given by Dr. Herring, which mentions exactly the same thing which you see in clinic. So that is what Dr. Nash himself saw in clinic, right? What happens is, if any condition gets suppressed and a different condition is found, when you give the right remedy, so how will you know that you have given the right remedy? The right remedy will first treat this, and once this is gone, this will come up, because the very cause was that this was suppressed, which gave rise to this. So this will come up, and now when you treat this with your homeopathic remedy, or you will finally cure the patient. You'll finally cure this from the roots of it, right? From the roots, because now you're not suppressing it. But now again, if you suppress it, meaning that if you apply ointment or if you do something like that, it will again give rise to severe gastralgia. That is what the law of cure says. If you go back and read it in details, you'll understand about this. So this is a clinical case of Dr. Nash. He saw this case in his own clinic. So this is what really happens. It is not a theoretical law. It actually happens. So what happened? Now she asked that if she could get anything for eczema, which had written. Dr. Nash told her if she applies ointment for the eczema, the gastralgia will return. See, that is what he said. Because it is a law of cure. Whatever has been suppressed will again come up. And if you cure this through homeopathy, or if you cure this and not suppress it, only then the patient is completely better, completely cured, and the disease is gone away from its roots. But now again, if you apply ointments, or again if you suppress the disease, severe gastralgia will be the result. Okay, so now he tells us arsenic is a remedy for the for slow fevers. So for fevers like typhoid, okay, this is the first remedy that people think about. Okay, so there's a person called Bear, and he says that since arsenic is more than any other remedy adopted to the worst forms of infectious diseases. So since that these people know, okay, so that person knows that this is the remedy which is very often indicated for slow fevers, for typhoid fevers. He knows that for infectious fevers. So now what this person says, now this person's name is actually Bear, okay, that is what he tells us in his book. Dr. Nash tells in his book. So this person says that what he wants to tell us is that because this remedy is indicated for typhoid fever anyway, so there is going to be a stage which comes on, okay, the later stage. As you know that this remedy is not for the earlier stages of inflammation but later stages. So one day or today or tomorrow, that stage is going to come in which the patient has the arsenic kind of symptoms. So he says that let's give arsenic earlier only, because so let's just give it so that stage never arises. So let's just give it from the beginning of the attack, in every case. That is what he says. But now what Dr. Nash has to comment on this, he says that he does not find it to be a good reasoning, a sound reasoning, or a good advice, because there is no such rule that they can apply, right? Because they cannot decide that this case is obviously going to be a arsenic case in future. We cannot just anticipate and give arsenic because we think that maybe tomorrow this patient will have arsenic kind of symptoms. Okay, just because he has typhoid fever, and just because you think that maybe he will go into the typhoid arsenic state, you cannot give arsenic from now only. Let the state arise and then you can give arsenic. You should not wait until the patient is completely exhausted and completely reduced of his vitality, but yeah, let the state at least arise and then you can prescribe arsenic, because there is not only arsenic as a remedy for typhoid. Okay, there can be carbo veg, which is a good remedy for such fevers. There can be muriatic acid, which is a good remedy for such kind of fevers. So you cannot anticipate that arsenic is only the remedy which is going to be the remedy that will cure your patient, that your patient will present with. So that is not a good thing to do. You should wait and see what picture arises, what totality of symptoms is presented to you, and only then prescribe on the basis of totality symptoms. And then after that, if the totality of symptoms tell you that arsenic is the remedy, then yeah, you can give arsenic, but just do not do it blindly, just because you think that it is going to happen. Okay, so that's what he tells us, and then further he moves ahead to talk about the next thing, the GIT, the action on GIT that this remedy has. So we've already discussed two characteristic points of this remedy, right? The restlessness of this remedy and the burning sensation of this remedy. Now we will discuss the sphere of action, on first of all on GIT and then on respiratory organs, and then we will go to the another characteristic point, which is prostration. Okay, so let's start with GIT. Okay, so in GIT, he mentions the symptoms under lips, tongue, mouth, and throat, and in the same way. Okay, so in lips, he says that the lips are dry, parched, and cracked. So I hope you remember the remedy which we've discussed earlier, which has the same kind of lips, in which we've presented to you the same picture. The remedy was bryonia. Okay, bryonia. Bry is dry is dry. So there's great dryness in bryonia, and that is why it is also reflected in the lips. The lips are also dry. Now here we're talking about arsenic, and here also the lips are dry, parched, and cracked. And they are so dry, so much, so that the patient often licks them to moisten them. Okay, then we go to tongue, which is also dry. So see, dryness is over all over the place. So tongue dry, red with raised papilla, red with indented edges, meaning that the teeth are there around our tongue, so the tongue will get the markings of the teeth on it. So if you go and see the images for this, you will find such kinds of tongues. Okay, so there is this indentation on the tongue because of the teeth. So red with indented edges, raised papilla, lead colored tongue, white or chalk or white paint, dry brown or black, especially in typhoid. So there is variety of kind of tongues that we find in arsenic. So they can be dry, brown, black, especially in typhoid. It can also be white color, white paint or white chalk. So we've seen a very characteristic, a remedy which is very characteristically this kind of tongue, white painted tongue. And that remedy was antim crude. I hope you remember that remedy was antim crude, and now we're talking also about arsenic. So arsenic can also have this kind of a tongue. It can also have black, it can also have white, so black and white both are there. Red is there, red is normal only, and this red will get even more reddened. Indented edges can be there, raised papilla can be there, red colored. In mouth and throat, there are dry, aphthous, ulcerative, gangrenous kind of mouth and throat symptoms. And thirst, so in thirst, this patient actually has indescribably intense and peculiar thirst. Indescribably intense. So how much thirst must he have, because it cannot even be described. But even if the intensity is great, so see, just now we saw that Dr. Nash uses the word indescribably, meaning that it is really great. So the thirst is so much. But even if the intensity is great, the patient can take only little water at a time. See the irony of it. So even if he has intense great, he has lot of thirst, indescribable thirst, he can only take a little water at a time. He takes sips of water at a time. Okay, sips of water. So he'll take one sip now, then again little time goes, he'll take another sip, then again after 3 minutes he'll take again another sip. Even if he has this great thirst, he cannot drink a lot of water at a single time. So that's an important symptom of arsenic thirst. Okay, you will find this even in the acute situation. So if a patient comes to you with cold and cough, okay, if he has nasal discharge, watery, vagara, if he's prostrated, he will also describe to you this thirst, and you will find the tongue and everything to be of arsenic, and you can prescribe arsenic, and it will help the patient if all the characteristic symptoms or one or two characteristic symptoms of arsenic are present. Okay, and there's no contraindication, then it will help. Okay, now we talked about lips, tongue, mouth and throat, about thirst. Let's go to the stomach related symptoms of this remedy. So in stomach also, this patient, it's a great remedy actually for any stomach related infections, for food poisoning, for nausea, vomiting, diarrhea, etc. So let's see how it helps. So this patient has a stomach which is very irritable, taking the least amount of food or drink. So even least amount of kind of any kind of food or drink will cause him aggravation. This patient has this ailments from cold drinks. Okay, ailments from cold drinks, ice water, ice cream, okay, anything cold is going to cause problem to this patient, will irritate the stomach. Okay, and it may cause vomiting, it may cause diarrhea, it may cause distress and pain. Okay, so ailments from cold drinks, ice water, ice cream, especially causing vomiting, distress, and pain and diarrhea. So, what is there in vomiting? So, in vomiting, this patient will vomit all kinds of and grades of substances. He might vomit water, mucus, bile, blood, coffee ground substances, meaning brownish color, dark colored substances that he might vomit out. So any kind of substance. In diarrhea also, all kind of stools. So everything is there in this remedy, all kinds of substances, all kinds of stools will be especially all kinds of vomitus and all kinds of stools. So simple watery to black bloody horribly offensive stool. It may be simple watery also, or maybe black bloody horribly offensive also. Now distress and pain, may what we see is that the abdominal pain is so intense that it causes the patient to turn and twist in all directions and shapes. So restlessness is there, okay, in this remedy. So the patient will want to turn and twist in all the directions and shapes. Now here, this patient, whenever in alimentary canal there is slightest irritation, there may be even slightest irritation that has happened to most intense inflammatory and malignant forms of disease, okay, like typhoid, etc. So even if there is some slight irritation because he has drunk some cold water, etc., or maybe he has intense inflammatory and malignant forms of disease like typhoid or anything, in both or all of them, from here to here, there will be characteristic burning present, which is um aggravated by actually at midnight and ameliorated by heat. So I've written it opposite. So aggravation at midnight and amelioration by heat. So aggravation at midnight you can remember with this beautiful clock. Okay, so it's midnight, it's 12 a.m. and it's night. So that is why it's night. Okay, it's 12 a.m. that happens 12 a.m. and not 12 p.m. because it's night. So 12 a.m. is the time. So aggravated at midnight and ameliorated by heat will be there. Alright, so that's there in the stomach related symptoms. Let's go to the action of this remedy on the respiratory organs. So when we talk about the action on respiratory organs, the patient might come to you with acute coryza or might come to you with any kind of lung affection. So what happens in acute coryza is that Dr. Nash says that arsenic stands in the front rank. Front rank, the choice often having to be made between arsenic, Allium cepa and murk. So the remedy stands in the front track. So it is a main remedy for acute coryza. Okay, when acute coryza patient comes to you with what is coryza first of all? So there is this kind of a watery discharge from your nose. Okay, and you have this cold, and you have lot of discharge coming out of your nose. You have got this cold and cough. So that is acute coryza. Okay, in acute coryza, the patient arsenic will stand in front rank. This remedy stands in front rank. So if patient comes to you, then the choice is often to be made between arsenic, Allium cepa and murk for fluent coryza, meaning a lot of watery discharge. If the patient comes to you with a lot of watery discharge, Dr. Nash says that you have to choose one remedy among these three remedies. Okay, so arsenic has this fluent discharge which corrodes the lips and wings of the nose and more burning than other two remedies. So even Allium cepa and murk have burning, but arsenic will have the most burning. So what happens is you have this nasal discharge going on for 1 day, 2 days, and now it has started to cause you burning. It will burn, it will corrode your lips and your wings of the nose. Okay, your wings of the nose, it will corrode, right? So this is your nose ka wings, it will corrode this, it will also corrode your lips. That happens. And then he tells us that this remedy, which is arsenic, can be followed after murk. So it often follows well after murk. So if you have given your patient murk because he came to you with the symptoms of murk, you gave him murk, after that most probably a symptom picture of arsenic will develop and you will need to give arsenic. It works very good when given after murk. Or if you have given Merck, but Merck has only partially relieved the patient, only partially relieved, okay, the patient felt better but only 50% felt better, then you can give arsenic and it will help the patient get completely better. Then we come to the lung affections. So in lung affections, what happens is especially asthma. So this remedy is very good for asthma, okay. So breathing is oppressed, you know, in asthma that happens, breathing is oppressed, respiration is wheezing kind of, that also happens in asthma. It is a common symptom, these both are common symptoms, plus there is cough and the expectoration is frothy. Now here comes the main important symptoms, the modalities of arsenic. Patient cannot lie down, must sit up to breathe, and is unable to move without being greatly put out of breath. So even little movement he cannot do. Even little movement he will do, and he's out of his breath. Okay. After that, he says that the air passage seemed constricted, which is also what happens in asthma. Asthma is caused or aggravated by suppressed eruptions. See, you had some eruptions which were suppressed, then you got asthma. You never had asthma ahead before in your life, but some eruptions you came up with, okay, some skin disease, some eruptions, and you suppressed it with ointment, something. After that you developed asthma. Now if you cure asthma, your eruptions will again come up, and when you again give medicine for your eruptions, when they go away, this finally the disease is completely gone away and it won't return. So example, pneumonia from retrocedent measles, sorry. So pneumonia from measles which you had, you got measles, you suppressed them, and now pneumonia has developed. Or chronic lung troubles from suppressed eczema. You had eczema, which is a dry skin wala condition, and you suppress that, and then chronic lung. Now he tells us about a case. He had a case of asthma of years standing. So the patient had asthma from many years, and Dr. Nash was called for a visit at midnight, 12 a.m., because they were afraid that the patient would die before morning. So see, we have already discussed when we were talking about the differentiation in aconite video that arsenic patient has, see, aconite has a fear of death, but what arsenic has, arsenic feels that the disease is incurable, that he is going to die, and because of that he has fear. So the patient was here also afraid that he would die, okay, because the disease is incurable, he will not feel better, okay. And her attacks always came at 1 a.m., so they were always around midnight, always. Okay, now that is why he gave arsenic alum. We have two important symptoms of arsenic. He gave arsenic alum. Maybe there are others also, he has mentioned only these two, and the patient was completely cured. Okay, that is how he gives us confidence about this remedy and about the cases we can help our patients with this. Then symptom by Rollin R. Gregg is that acute sharp fixed or darty pain in the apex and through the upper third of the right lung. So this is your right lung, and he says that in the apex. So this is the apex and through the upper third of right lung. Upper third. So this is the upper lobe. See, upper lobe, middle lobe, and the lower lobe is present in your right lung. So the upper lobe is obviously the upper third part of your lung. So the upper lobe and the apex. So this region is involved in arsenic. That is what Dr. Rollin R. Gregg says. Okay, this region is involved in arsenic. Remember it. The right lung, the apex, the upper lobe is involved. It is used in the last stage of pneumonia of old people plus gangrenous expectoration plus arsenic-like symptoms. So burning, restlessness, prostration are arsenic symptoms. So other arsenic symptoms are present, and gangrenous expectoration and old people ka pneumonia. Last stage. So we've already discussed that this remedy is not for the earlier stages but for the last stages. So that's there. So finally, he comes to the top point, very important point of arsenic, which is the prostration of the remedy, the exhaustion, the fatigue that this remedy has. So in both acute and chronic conditions, this patient is exhausted from slightest exertion. He must lie down. From slightest exertion, there will be great exhaustion. So this patient, he is exhausted completely, lying down, just sitting in the chair and drooping down. So I hope you remember we've used this picture in another remedy as well. It was colchicum, right? Colchicum also had this great fatigue. So this person, we have used him in colchicum, and now we're using in arsenic. So you should remember that both these remedies have exhaustion. So in both acute and chronic affections, these people will be exhausted from slightest exertion. They must lie down. Now this arsenic patient is weak out of proportion. See, out of proportion meaning what? जितना proportion में होना चाहिए उतना नहीं. He is greatly out of proportion weak. to the rest of his troubles. And this extreme prostration comes on very, very rapidly. So it's not like slowly he's going to, he's getting weak, he's getting slowly fatigued, exhausted, nothing like that. Very, very rapidly he will get extremely prostrated. Now, this extreme prostration is especially seen in typhoid. And when we talk about typhoid, the other remedies that we also talk about are carboxylic and muriatic acid along with arsenic. So, in arsenic, this patient wants to move or be moved constantly because there is this extreme restlessness in this patient. They want to move or be moved constantly. But in carboxylic and muriatic acid, what happens is that there is almost utter absence of any show of life, meaning they're extremely weak, so weak that they do not even want to, move a little bit, so that you will understand that they are alive and not dead. There is any absence of any show of life. They are completely, lying so still that you may even confuse them to be dead. So that is what is there. In arsenic, they want to move constantly, but in carboxylic and muriatic acid, they will lie still. Okay, both are used in extreme prostration wala stage of typhoid, but that is how they are different. Now, there is also a sense of weakness in this remedy. If it's general, okay, in this remedy it's general. Okay, in arsenic it's general. Now, if we talk in general about the sense of weakness, then arsenic में general sense of weakness है, मतलब everywhere there is weakness, he will completely feel weak. But some remedies have local feeling of weakness. Okay, like some remedies feel that they have this weakness which is felt especially in the chest. So in the chest, if it is felt, then the remedies of phosphoric acid, stannum and sulfur. If it is felt in abdomen, they feel the weakness especially in the abdomen, then the remedy is phosphorus. If they feel it in stomach, then the remedy is ignatia, hydrustis, sepia. Okay, let's go over it again. In chest, phosphoric acid, stannum and sulfur. In abdomen, phosphorus. In stomach, ignatia, hydrustis and sepia. So that is a very, very characteristic point of our remedy arsenic. Okay, prostration. Alright, so he just wants to lie down. He's completely prostrated, but still he actually lies down because of the prostration, but he wants from inside, he wants to move or be moved constantly. Okay, so that's the thing about prostration. So what all did we learn in arsenic? Let's just go over it very, very quickly. Let's just talk about the most important symptoms of arsenic. So first of all, we talked about the restlessness of this remedy, in which we compared it with aconite. Aconite had this restlessness, especially in the earlier stages of inflammation, whereas arsenic had it in the later stages of inflammation. Aconite had it with high grade fever, arsenic had it with low grade fever. Both the remedies wanted to, toss about in agony and fear, but arsenic was too weak to do that, so he couldn't, and aconite could. Aconite had a fear of death, arsenic had a fear that he is going to die. The disease is incurable. Then we talked about the burning of this remedy. So in burning, we saw that this patient has burning all over, throat may, nasal discharge, everything is completely burning, but he feels better with this hot application only. Okay, even if it is burning, there is better relief only after hot application or warm room or anything, warm stove wala heat, anything. Then here we compared it with another remedy which was Sequel Core, which is objectively cold, but inside may say there is burning. From the inside they feel it's burning, and they are completely averse to any kind of hot applications, even do not want to be covered. Alright, this patient will have burning in throat but will feel better only after drinking hot water or hot applications or hot food. Okay, and then we talked about the GIT related symptoms, in which we saw that the lips of this remedy are dry, cracked, parched. The tongue is also dry, indented, or it can be also white, it can be also black, it can be red, it can be lead colored. Okay, then we talked about the mouth also, which is dry. Then the thirst of this remedy, very characteristic thirst of this remedy, that they want to have little sips of water at small intervals of time, because it is indescribable intense thirst. But even if the intensity is so great, they cannot take a lot of water. They have to take little water, sips of water. Okay, then we went on to talk about the stomach related symptoms, in which we talked about the ailments from which was the cold drinks, cold ice cream, or anything cold. Okay, if they take anything cold, they will maybe have vomiting, maybe have diarrhea, maybe have distress and pain. In vomiting, all kinds of vomiting will be there. It may be just water that they vomit out, or it may be coffee ground substance, blood that they vomit out. Any kind of vomiting can be there. In diarrhea also, it can be simple watery diarrhea, or it can be black, bloody, horribly offensive diarrhea. And in distress and pain, there can be abdominal pain, which is very, very intense. They want to turn and twist. Okay, but the symptom which is very, very characteristically present even in the stomach is this, that there is burning unled by heat. Okay, and there's also aggravation by at midnight, which is a very characteristic symptom of this remedy, and it is also present in the stomach related symptoms, or in fact every symptom of arsenic. Okay, there's aggravation at midnight. Then we went on to talk about the respiratory organs, in which we talked about the flu and coryza that this remedy has, and the remedies competing with it for the flu and coryza are allium cepa and merc. In lung affections, especially for asthma, this remedy is used. Okay, there's extreme frustration in typhoid, and then we went on to talk about the prostration, and where we talked about the extreme frustration which comes on very rapidly, and especially in typhoid, where we differentiated it with carboveg and muriatic acid, which are very completely there is no show of life. They're completely, they feel like we just feel like they're dead, more dead than alive. But arsenic wants to completely all the time move, and that will show you that he is not dead. He has some kind of movement. But then yeah, that's it. But then we talked about the sense of weakness, which can be, if it's general, it's mostly in arsenic general, and if it's local, then it can be in chest, it can be in abdomen, it can be in stomach. If it's in chest, we talked about the remedies like phosphoric acid, stannum and sulfur. Abdomen may phosphorus and sulfur. Stomach may ignatia, hydrastis and sepia are there. So that's all. There's extreme frustration, there is cold water aggravation. Stomach related symptoms are also aggravated by ameliorated by heat and aggravated at midnight, and everything is aggravated at midnight and ameliorated by heat. Burning is present, especially there's restlessness which wants him to move, wants him to be moved or himself to move, and there is dryness all over in the lips, in the stomach, in the mouth. Okay, so that's what we talked about in the remedy arsenic album. Alright, okay, so let's meet in the next video, in which we will talk about the third remedy, which forms the trio of restlessness, which is rustox. Bye bye.